If I'm going to sew up fascia or muscle on an abdomen, how do I know what suture I need? How do I know that I might need a 1 or a 4-0? If you think about what it is that you're doing, that can help you know what size of needle you need, what size of thread you need. The O and the 1 is the size of the suture, which is like the thread. This is a needle. This is a CTX. This is a CT1. This is an FS1 on a 3-0 vicryl. So how would you know what to use? If you're going to sew fascia together or you're going to close a porthole, you're going to need different sutures for different things. If you're going to sew fascia or muscle together, you're going to need something bigger. You're going to need like a 1 or a 0. If you've done a laparoscopic cholecystectomy and you're just going to close a small little porthole, you're going to need something smaller. So you're going to need something like a 3-0, maybe on an SH needle. If I'm closing down in the abdomen, I'm closing muscle together, do you think I need a little SH? I'm probably going to need a bigger needle in this. So I'm probably going to go with something that has a needle like this, or a CT1. Something that has a big curve to it. So when they suture that, it gets a good bite and it spins all the way through the fascia and the muscle, and it can grab it on the other side. If you're sewing small into a small hole, probably a smaller needle. If you're sewing a little porthole, an SH or like a PS2, something in there might help. The deeper down you go, the bigger suture you need. The deeper you go in your layers, typically the bigger the suture will get. Smaller the hole and the closer to the top, to the skin, smaller. You're going to start deeper, bigger, and work your way to smaller as you get up. Your sizes are here. 2-0, think of that as -2. Think of this as -3, -4. So you're getting smaller as you go farther down the negatives. You're getting bigger as you go up your whole numbers. Your 0s, your 1s, your 2s, your 3s, your 4s, your 5s. They're going up and they're getting thicker thread or suture.